Shigellosis is an acute enteric infection caused by Shigella bacteria. There are about 125 million cases and 164,000 deaths per year, mainly in the developing world and among children under 5. Acute infection with erratic damage to the colonic epithelium begins 1 to 4 days after infection. Symptoms include diarrhea or dysentery and may be associated with fever, abdominal cramping, and tenesmus, which is the urge to void the bowels even when they're already empty. Severe cases can last 4 to 6 weeks, but are usually self-limited. Complications can include hemolytic uremic syndrome and post-reactive arthritis. Kiyoshi Shiga identified Shigella as the cause of bacillary dysentery in 1897. Shigella are non-motile, rod-shaped, facultatively anaerobic gram-negative bacteria in the Enterobacteriaceae. The 4 main Shigella subtypes are closely related to E. coli, but are biochemically distinct and only infect primates. Shigella is easily transmitted through the fecal-oral route, either person to person or through contaminated food or water. Shigella are not destroyed by gastric acid and pass through the gastrointestinal tract to the small intestine where they multiply. In the large intestine, they cause injury by direct invasion of epithelial cells and via release of enterotoxins 1 and 2. As few as 10 Shigella dysenteric bacteria can cause infection. Shigella enters the epithelium through M cell membrane ruffling. They're transported to the M cell pocket and endocytosed by macrophages. Pro-inflammatory cytokines such as IL-1 and chemotactic cytokines such as IL-8 destabilize the epithelial barrier. Polymorphonuclear leukocytes are recruited to the apical epithelium, which allows entry of even more Shigella. Shigella enter epithelial cells via macropinocytosis through the basolateral membrane, where they escape and replicate in the cytoplasm and then spread to adjacent cells. Shigella has a circular chromosome containing pathogenicity islands, as well as a virulence plasmid containing a 30 kilobase entry region that encodes a type 3 secretion system, as well as the IPA and IPG genes involved in invasion of epithelial cells. Shigella secretes virulence factors that induce inflammation and cause watery diarrhea early in infection. Shigella also injects virulence effectors to allow invasion of epithelial cells, which damages the colonic epithelium. Shigella releases effectors to evade the innate immune response, which both promotes infection and limits the ability of the adaptive immune response to prevent future reinfection. No vaccine is available, but transmission can be reduced with hand washing. Stool culture should be used for diagnosis, and antimicrobial susceptibility testing should be used to guide selection of antimicrobial treatments. Shigellosis is usually self-limited with supportive care and fluid replacement. Bismuth subsalicylate can be used, but loperamide is not recommended. Antibiotics such as ciprofloxacin and azithromycin can be used to speed recovery and limit transition, but antibiotic resistance is common. Last week, the CDC issued a warning about a sharp rise in extensively drug-resistant, or XDR, Shigella infections in the United States. XDR Shigella strains are resistant to all commonly recommended antibiotics, including azithromycin, ciprofloxacin, ceftriaxone, trimethoprim sulfamethoxazole, and ampicillin. The frequency of XDR infections increased from 0% in 2015 to 5% in 2022 and occurs mainly in adults. XDR infections are most common in men who have sex with men, or MSM, the homeless, international travelers, and HIV patients. The CDC has no recommendation for optimal treatment, but the UK has outlined 2 strategies: oral pivmethicillinum and fosfomycin, or IV carbapenems and colistin for hospitalized patients. Shigella is one of the oldest human pathogens and is responsible for millions of infections and hundreds of thousands of deaths each year. Shigella normally infects young children and resolves without treatment. However, there has been a sharp increase in the number of extensively drug-resistant Shigella infections that occur mainly in adults. The pandemic has resulted in a surge of treatment-resistant infections, reversing years of progress. Thank you very much.